Hi, my name is Maria and you're watching BYTV. And today we'll be talking about women's health issues, in particular women's hearts. And so today, here in the studio to help us, we have Dr. Andy Mencia, a successful businessman and entrepreneur, and also founder of Adult and Geriatric Health Center in Fort Lauderdale, Florida, which I hear is a state-of-the-art medical and dental office, correct?
It is, Maria.
Yes,
yeah.
Okay, great. So I know one of the main things we need to be aware of are the symptoms of a heart attack, because I know, in the movies they have the clutching of the heart, but we want to know what the, real-life symptoms we can be aware of and look.
Well, Maria, first of all, thank you for having me. I'm so happy being here with you, and I look to many more programs like this, where we are educating the public, because through education, what we are doing, we are empowering you to be able to take better care of yourself. And also, when you go to the doctor, you can discuss, because you're going to be better informed, what your symptoms are. So when it comes to a heart attack, the classical symptom that the general population feel is that crushing chest pain. Yeah. Some people describe it like an elephant sitting on your chest. Mm-hmm. When it comes to women's health, it's a completely different ballgame. And there is a biological reason for that. Mm-hmm. It's not that women are crazy and men are not. There are many biological reasons why a woman's symptoms are, very different from a man. And why is this important? We bring it up to you today, is because women tend to ignore those symptoms related to a heart condition. They usually try to write it off as neck pain. And just to bring you a case, Maria, that I have recently, was a patient that was having jaw pain. And the first thing she did, she called the dentist and then say, I think I'm having cavity or something, I need to be seen. Mm-hmm. So the dentist said, there's no emergency, it's on a Friday, come back next week, and they gave her like 5 to 6 days later appointment. Mm-hmm. But what transpired in the meantime, she happened to come for a checkup with me, and when she described the symptom, I look into her mouth is beautiful. There's no one cavity I could see. Although I didn't take x-ray, I said, let's do an electrocardiogram. And she was just having one of those silent heart attacks that we often describe. So of course, then we have to transport her to the emergency room and put her on medication. Mm-hmm. And that's why I think this program is so important, because when it comes to women and heart disease, we tend to overlook the symptom in women. In men and in the general population, what we see out there is that chest pain usually is associated with some nausea. The patient feels nauseated, like they want to vomit, but they mm-hmm. don't throw up. They break into a cold sweat. Mm-hmm. Usually it's related to some form of activity or stress. And one of the most common stress I have seen in my 20 years of practice is when a person is having 6, 7, 8, 20 people coming over the house, and the wife is cooking for everybody and making sure everything is ready, and they are going through all this stress, and they start feeling that shortness of breath, and they start breaking into that cold sweat, and they won't get the chest pain like a man will get. And so sometimes we get confused with it too. Well, if it's a man going through the same thing, they will complain of the elephant sitting on their chest, that pain going to the left arm. Very classical symptom that anybody that knows what a heart attack or have heard of somebody having one will be able to pick it up very easily, knowing a woman.
Yeah. I think women also have this idea of they have to take care of anyone and everyone else and
they are
put
the caregiver,
last.
right? Exactly.
So that's one of the reasons they overlook it.
So if we have 20 people coming to the house, my duty is to make sure that everything goes fine, exactly. And my heart can wait for later. Absolutely.
I know. One of my questions, advice for people, because with technology nowadays, people will jump on Google,
absolutely.
Maybe Google symptoms. What if they realize they're getting some but not all of the symptoms? For example, pain, the jaw pain.
Well, Maria, that's the classical. That's the classical thing for a woman. A woman might present with neck pain or upper back pain. A man usually have left arm, the pain will radiate down to the left arm. So you have a chest pain and it's sort of traveling to. That's what we call radiation too. It's traveling to the left arm. In a woman, it will travel to the right arm. So they would say maybe a little arthritis, especially if I'm right-handed.
Okay.
Maybe I'm just tired of using my right hand. They might present with a little shortness of breath. You know, they might present just with shortness of breath and a little bit of nausea, or shortness of breath, and they break it into a cold sweat. And many times, in you women, you say, "Oh, maybe I'm going through the changes. Maybe my hormones is off balance." So there are so many reasons we can find out there to say what is going on with us that we can write it off into something else. In a man, it's so classical, it's most likely for us to write it off, but in women, it's very common. And it is so common, Maria, that when we look at heart disease, and this could be an eye-opener for the audience, when we look at heart disease, more women die from heart disease than men. And even though women outlive men, but when it comes to heart disease, more women end up dying with the condition than men.
Okay.
Because we are chicken, we run to the emergency room.
So what would you say if a woman, does realize, okay, I'm in the middle of experiencing the symptoms of a heart attack, what should be the next step now? What's the first thing I should do? Should I write it out, wait to see if it passes?
Never. If you come to a center like us, that we are open 6 days a week, call your doctor. The first thing that I advise my patient to do, always have baby aspirin at hand and chew on an aspirin. Don't swallow an aspirin. Because you want the aspirin to go straight into the blood vessel of the heart. So you want to chew on an aspirin, and by chewing on an aspirin, what you are doing now, you are immediately, at the moment, making the blood thinner than what it is. Now, some people might say, well, if I start chewing on 1 or 2 or 3 aspirin, I might bleed a little bit. That's okay, we can handle that. We can handle a little bleeding much better than handling a heart attack. And what is very, very important for people to know is when you're having a heart attack, you are losing tissue of your heart. So it's like a fire in a forest. If you can contain the fire, you won't lose the entire forest. So what you want to do is, by taking aspirin, you are taking the little area of your heart that is in fire and putting the fire out. So it doesn't spread, because the more it spread, the major the consequences of a heart attack is going to be. And it can debilitate, not only kill you, it can only, you can end up being very debilitated with after a heart attack.
So that's the aspirin's a really good tip then, to keep things under control until help comes. Now, my next question is, let's say the ambulance comes or you get to the emergency room. Are there any medical terms we need to know to explain to the doctor to help us faster, or ask for specific type of tests to say, the next step? What do you think? That's
an excellent question, because if you go through what are the risks, the men and women, but especially in women, the risks that put us at close to having a heart attack, or more prone to a heart attack than another woman, is that number one, if when you were pregnant, you have elevated sugar, you have what we call gestational diabetes. So you have high sugar when you were pregnant, that is a risk factor that you have to let your doctor know, so they don't write it off. A lot of time it is not you that is writing it off. It's the emergency room doctor that says, oh, you are having nothing, it's a little indigestion, go home. So you want to let them know, these are my risk factors. When I was pregnant, I have elevated sugar. When I was pregnant, I have elevated blood pressure that came down. Those are risk factors. There is a condition that we call metabolic syndrome. And metabolic syndrome entails a person that have a high waistline. So in a woman, it's more than 35 centimeters in the waistline. In addition to that, they have a tendency on having slightly elevated sugar. They might not be called a diabetic yet, but they have that waistline, they have elevated sugar. They might or might not have a little elevation of their blood pressure. When they get the blood test done, the doctor might tell you, your primary care might have said to you that your triglyceride, one of your bad cholesterol, is slightly elevated. So when you have this, it's called metabolic syndrome, let the emergency room doctor that you've been diagnosed with metabolic syndrome, that you have gestational diabetes, that when you were pregnant, your blood pressure had to be controlled during the pregnancy. Because all of these are, all these people that have a metabolic syndrome, they will be more prone to having a heart attack than people that have not had that. Yeah. If you've been going to the doctor, a lot of time I get patients that come to me, Maria, because I do the homeopathic treatment as well as the traditional treatment for my patient. So a lot of time I have patients that they come, I have a pastor that he came to me with elevated blood pressure, and he say, you know, Dr. Mencia, let's go natural. I say, okay, let's do the garlic, and let's do the cinnamon, and let's do the different products that I recommended, and his blood pressure came down, he lost some weight, and we did fine. But if my pastor end up in the emergency room, he doesn't want to write off or not tell the emergency room personnel that he had been treated for high blood pressure. Okay. Because you go natural doesn't mean you don't have it.
Exactly.
You have to say, you know, one of my risks is high blood pressure. But when we started the program, Maria, one of the things that we say is that women don't have different symptoms, not because they are crazy and men are chicken and they run to the ER. There is a biological reason why women present differently. And this is important for the audience to understand that. In us men, when we are having a heart attack, it's usually the major blood vessels that will tend to shut down on us. Well, in you women, when you guys are having a heart attack, it's not those major blood vessels, it's those tiny blood vessels that go inside the muscle of the heart. And because of those tiny blood vessels, the presentation is quite different. So that's one of the main reasons. And a lot of the study we have done after a person diagnosed, and we go back and we look at their heart, they are, in women, the major blood vessels look clean. And this is important because if you go to a doctor that don't understand the difference between the condition in a man and the condition in a woman, the doctor might do what we call a cardiac catheterization, and that is when we go through one of your blood vessels and we start driving through and going to the heart, and then we put the catheter in the major blood vessel of the heart. If I'm having a heart attack, when you do that, you're going to say, oh, here's the guy. This is why Dr. Mencia is having his heart attack. When they do it in a woman, you go and you look at all of those blood vessels, they look clean. Because those tests don't look at the minor blood vessel. But if I take you then and I put you to a stress test, either a chemical stress test where we give you a medication that will make your heart demand more oxygen, and then we take pictures and we see where in the heart you are lacking oxygen, and then we can say, oh, this is where the problem is. This is where the fire is in the forest. Well, in a man, just usually by doing the catheterization, we can find out. So a woman might need to go through a few more tests to make sure that they get diagnosed. Because even if you go to the emergency room, even if you have a cardiologist that don't make the distinction between men and women, they might override you and say, you know, I think you are okay, when in reality you are not.
Yeah, that's really interesting because I didn't know that difference. So it is good for women, as you know, to be aware of this and to take the extra tests to take care of themselves. Also, I just want to wrap up and maybe ask about preventative measures that women can do to maybe even avoid getting this. Are there any healthy habits?
The love of my life. The love of my life, because I love, as a doctor, I love to be able to prevent anything from happening. And that's why I love doing this program with you, because when you sit down to prevent a condition, that's key. So we spoke about the metabolic syndrome, and we heard about the metabolic syndrome, the waist size. In a woman 35 or above, you are at risk. Below 35, you are okay, or you are, less of a chance of having a problem. So what are the things we can do? If you have tendency to diabetes, try to get your sugar under control. Now, the first myth with diabetes is that people think if you are diabetic, you have to take medication. Not true. If you are diabetic, you have to eat well, and you have to exercise, and cheating will never be forgiven. Right? So if you do the right thing, you can control your sugar without taking medication. You know, you can take cinnamon. Cinnamon is really good to bring down. And if it comes to the point that you have to take a medication, Maria, then we take it. But, you know, people can on their own try to bring down the sugar. Number 2, high blood pressure, same thing. Eat healthy, exercise. Don't be a couch potato. So get up, exercise, find something to do, keep yourself active. A couch potato will be prone to having high blood pressure versus a person that is more active. Myth, because I work, I don't need to exercise because I'm already active. Not true. Mm-hmm. You know, we have all the people working with us here in the set, and they are working, but that doesn't mean they are exercising, they are burning calories. So what is exercise to us? We're talking about 30 to 60 minutes of exercise, mm-hmm. at least 3 to 4 times a week. If you do a minimum of 3, I'm happy. If your intention is to lose weight, it's no longer 30 to 60 minutes. Now you have to bring it up 60 to 90 minutes, mm-hmm. 2 to 3 times a week. And that's to lose weight. If it's just to maintain yourself, 30 to 60 minutes of exercise. And a healthy diet, you know, you don't have to go and join these groups that cost you money. It's what you put, you know, in your mouth, what you're gonna eat. So eat healthy. Mediterranean food mm-hmm. seems to be very healthy, and pick and choose your battle. And as a physician, I treat people from so many different races and so many different cultures. So when it comes to diabetes, it's all the starches that we need to cut down. Diabetes is not sugar. Diabetes is sugar plus all the starches. Mm-hmm. So the rice, the pasta, the potato, the bread. Mm-hmm. People say, oh, I don't eat any of that stuff. But then when I say fruits, oh my God, I love fruit. I'm eating, you know, so I eat so much fruits.
I like how you're saying, like, at the end of the day, the best preventative form is exercise and nutrition, which is what we know all the time. And people think, oh, if nobody's looking, is this cheating? Yeah. But it is, and you need to keep on track. So, Dr. Mencia, we thank you so much for coming and giving us all this valuable advice, and we hope it helps you guys out there. Ladies, take care of yourself. It's your health, it's your life, it's important. And once again, this is Maria, and you're watching BYTV.